Hey everybody, it's Dr. Mark Ricketts from LeMac Health. We're going to talk a little bit about colds and flu today. First thing you want to try to do is try to avoid having colds and flu. Now, there are four basic things you can do that will decrease your risk of having any kind of infection. One is to get plenty of sleep. You need to try to get at least 8 hours sleep a day. You need to drink lots of fluids, particularly water, because keeping those mucous membranes wet will help prevent you from getting sick. You need to wash your hands. When I mean that, with soap and water. Use waterless soap if you don't have soap and water. And if you're in a high risk group, either the very young or the very old, flu shot would be very important. Now, people always ask me, what's the difference between having the cold and having the flu? Well, number one, colds are just notorious this time of year. You've got kids in school, you've got kids coming from college. You're always going to get these, and those are usually going to be bacterial. You're going to have nasal congestion, sore throat, cough, usually some fever associated with it. It won't be intense, and about half the time that can be treated with over-the-counter medications such as Zicam, which is a zinc lozenge, which is great for treating that, and then your over-the-counter cold medications such as Sudafed or Robitussin DM and those sorts of things. Now, people ask, how do I know if I have the flu? Well, I can tell you from personal experience, the flu, you will know when you have it. You're going to have intense body aches. You'll have very high fevers, chills. Now, you usually will have a sore throat with that too, but that will come on days later. Sometimes there's nausea, vomiting, and diarrhea also associated with that. The folks that are going to be most prone to having these conditions are going to be the very young and the very old, even though all of us in the community can have it. Now, again, treatment for that's very supportive. We're going to use fluids, non-steroidal drugs such as Advil or Tylenol for the fever and chills. Now, if you do or know that you have been exposed to the flu and have not been vaccinated, we do have oral treatments, the most popular one being Tamiflu. You can take for 10 days, and this will decrease, not only can it possibly prevent it, but also decrease the amount of illness that you do have with that. We're going to talk about this more as the season goes on. If you've got any further questions, check in with us at www.lemachealth.com. We appreciate you taking time to listen to our post.